Kumusta? For today, we are going to have another lecture, and this is all about pneumothorax. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gaba and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational contents to help nursing students and nursing professionals with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational contents 2 to 3 times in a week. Don't miss that out. Subscribe now. Hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you ready? Let's do this. Good morning, good afternoon, and good night. Just in case I don't get to see you, you have a good one, baby. Welcome back nga sa ating discussion for today. Handa ka na ba sa panibagong aralin natin for today? Yes, because I'll have another medical surgical topic for you. We are going to have a thorough discussion of your pneumothorax. One of you guys actually requested this one. Gusto ko lang malaman mo kung meron ka pang mga request dyan na gusto mong gawin ko, gusto mong gawa natin ang reviewer at lecture, i-comment down mo na sa baba kagaya ng video na to. Na ano bang aasahan mo sa video na to? We are going to discuss about the causes, overview, diagnostic test, nursing assessment, nursing considerations, pharmacological therapy ng iyong pneumothorax, all of that good stuff at marami pang iba in one video. In order for me to do that, I will need to switch back to my PC and I'll see you guys in a bit. Hi everybody! Welcome nga sa ating formal discussion ng iyong pneumothorax nursing care management. Now this is another lecture sa ating medical surgical nursing na kung hindi mo pa napapanood yung other videos na create ko under sa topic na to ng MedSurg, I'll be putting the playlist on the description box or kapag nagpop-out yung icon button dyan, i-click mo lang yun, nandun yung playlist, okay? And some other playlists under nursing educational contents. Now simulan na natin ang ating discussion for today with our objectives. Now on this slide, on this discussion, you can expect that we're going to have the overview of your pneumothorax. What are the causes, clinical manifestations, assessment and diagnostics, medical management, surgical management, and your nursing management. Handa ka na? Let's begin. Overview. Now, pneumothorax is one of the disorders of the chest and lower respiratory tract. Pneumothorax or collapsed lung is the collection of air in the spaces around the lungs. The air buildup puts pressure on the lungs, so it cannot expand as much as it normally. Pneumothorax occurs when the parietal or visceral pleura is breached and the pleural space is exposed to positive atmospheric pressure. The pressure in the pleural space is normally negative. Alam kong alam mo yon pero in-emphasize ko lang. Now, a spontaneous pneumothorax occurs with the rupture of the bleb. Ano naman tong open pneumothorax? This occurs when an opening through the chest wall allows the entrance of positive atmospheric pressure into the pleural space. Diagnosis of pneumothorax is made by chest X-ray film. Okay, so that's like a mouthful overview, but basically that's it, okay? Now, proceed na tayo. What are the causes of your pneumothorax, nurses? Okay, the cause leads to the identification of the type of pneumothorax. Remember that. Alright, una, rupture of a bleb. A spontaneous pneumothorax may occur in an apparently healthy person in the absence of trauma due to rupture of an air-filled bleb. Ano pa? Blunt trauma. Blunt trauma like rib fractures could cause traumatic pneumothorax. Invasive procedures. Traumatic pneumothorax may occur during invasive thoracic procedures in which the pleura is inadvertently punctured, penetrating chest or abdominal trauma. Trauma such as stab wounds or gunshot wounds could cause traumatic pneumothorax. Once again, these are the causes, okay? Now, what are the clinical manifestations of pneumothorax? The signs and symptoms associated with pneumothorax depends on its size and cause. Isa-isahin natin yan. You have pain. Now, pain is usually sudden and may be pleuritic. Okay? Now, ano pa? Minimal respiratory distress. The patient may have only minimal respiratory distress with slight chest discomfort and tachypnea. Ano pa? Dyspnea. Syempre, hirap sa paghinga yan. Now, this is due to the pain and patient has difficulty in breathing. Central cyanosis nurses. The patient may develop central cyanosis from severe hypoxemia. Ano pa? Chest expansion. In simple and tension pneumothorax, chest expansion is decreased. Breath sounds. Breath sounds are diminished or absent in both simple and tension pneumothorax. Tracheal alignment nga po, nurse. Ano to? In simple pneumothorax, the trachea is midline, while in tension pneumothorax, the trachea is shifted away from the affected side. Once again, these are the clinical manifestations of your pneumothorax. I try to be very visual here using the images here, so para mas lalo kang, alam mo yun, mas lalo mong matandaan para sa mga visual learners natin, okay? Now, how are you going to assess and diagnose pneumothorax? Pneumothorax is assessed and diagnosed with the following. Chest X-ray. This will reveal air and or fluid accumulation in the pleural space. May show shift of mediastinal structures o yung ating heart. Next, hemoglobin. This may decrease indicating blood loss. Ano pa? Thoracentesis. Now, presence of blood or serosanguinous fluid indicates hemothorax. Ano pa? Thoracic CT. Now, study shows that CT is more sensitive than X-ray in indicating thoracic injuries, lung contusion, hemothorax, and pneumothorax. Early CT nga po may influence therapeutic management. Lastly, you have your ABGs. Ano yung makikita mo sa ABGs mo? Yung arterial blood gas. Variable depending on the degree of compromised lung function, altered breathing mechanics, and the ability to compensate partial pressure of oxygen. Now, partial pressure of oxygen may be normal or decreased. Oxygen saturation usually decrease, of course. Meron tayong punctured lung or meron tayong problema sa paghinga. So, anong aasahan mo sa partial pressure of oxygen mo at sa iyong O2 sat o di bagsak, okay? Next, what are the medical management? The medical management of pneumothorax depends on its cause and severity. Isa-isahin natin to. Una dyan, chest tube. A small chest tube is inserted near the second intercostal space to drain the fluid and air. For patients with jeopardized gas exchange, chest tube insertion may be necessary to achieve lung re-expansion. The priority is to maintain airway, breathing, and circulation. Ito kadalasan to ginagawa. Ito yung management natin, diba, sa pre-arrest, airway ABC, airway breathing, and circulation. The most important interventions focus on re-inflating the lung by evacuating the pleural air. Patients with primary spontaneous pneumothorax, that is small with minimal symptoms, may have spontaneous sealing and lung re-expansion. Ano pa? Maintain a closed chest drainage system. Be sure to tape all connections and secure the tube carefully at the insertion site with adhesive bandages. Regulate suction according to the chest tube system directions. Generally, suction does not exceed 20 to 25 centimeters of hydrogen negative pressure. Monitor a chest tube unit for any kinks or bubbling. Importante ito. Now, these could indicate an air leak, but do not clamp a chest tube without physician's order because clamping may lead to tension pneumothorax. Autotransfusion nga po. Now, autotransfusion involves taking the patient's own blood that has been drained from the chest, filtering it, and then transfusing it back into the vascular system. What else? Antibiotics. Antibiotics are usually prescribed to combat infection from contamination. Oxygen therapy. The patient with possible tension pneumothorax should immediately be given a high concentration of supplemental oxygen to treat hypoxemia. Alright, so surgical management na tayo ng ating pneumothorax. If more than 150 ml of blood is aspirated initially by thoracentesis, the rule is to open the chest wall surgically using thoracotomy. Now, in thoracotomy, the chest wall is opened surgically to remove the blood or air trapped in the pleural space. nursing management na tayo. Sa mga susunod na slide, tatalakayin natin yung assessment, diagnosis, and interventions. Kapit lang, eto na talaga. Okay, nursing assessment. Ano-ano yung mga i-assess mo, nurse? Now, you should assess the following: tracheal alignment, expansion of the chest, kung bilateral chest rise and fall ba, or yung isa lang yung tumataas. Breath sounds, diminished to weak breath sounds. Percussion of the chest, kung dull sound ba ito, kung ano pa yung nakakapa mo dyan. Yun yung mga dapat mong i-assess. Ano pa? In terms of diagnosis, di ba mayroon tayong nursing diagnosis? Ito na siya. Now, based on the assessment data, the major nursing diagnosis for the patients are the following: acute pain related to the positive pressure in the pleural space, ineffective breathing pattern related to respiratory distress, ineffective peripheral tissue perfusion related to severe hypoxemia, anxiety related to difficulty in breathing. Once again, these are your nursing diagnosis. How about your nursing interventions, you guys? Nursing interventions appropriate for patients suffering from pneumothorax are the following: re-expansion. Now, the patient is instructed to inhale and strain against a closed glottis to re-expand the lung and eject the air from the thorax. Sterile covering. The opening is plugged by sealing with what? Gauze impregnated with petroleum. Yes. Ano nga to? Vaselinized gauze, yung ganon. Para ma-avoid yung pagpasok ng positive pressure na air. Positive pressure atmospheric air yun, di ba? Kasi we wanna maintain the negative pressure of the lungs. Okay. Oxygen saturation. Pulse oximeter is used to monitor oxygen saturation. Remember? Alright. So thank you so much, you guys, for watching. I hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want me to do for you. Comment it down below. Abangan mo yung mga next nating video discussions, ha? And I want to grab this opportunity to thank all of you guys who's watching or listening right now, to my lovely, beautiful voice, for making this all happen. We've been really growing, and none of that will happen if it wasn't because of you. Thank you for believing in me, and thank you for believing in my channel, okay? Naipamalita mo na nga, para mas marami pang makaalam, sa Radyong Sira, ang pinakabago, pinaka-fresh, at ang pinakalibreng nursing review center sa balat ng YouTube. I'll see you again next time. You stay safe. Thank you so much, you guys, for watching. I hope you learned something. Help me grow my channel. You are already here. You might as well subscribe. #TeenCoolTalk. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists that are created for you. I'll be putting the links on the description box, so simply click the second button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galve. I'll see you again.